Sunshine, it's our sunshine.
Hello, this is Dr. Ranganadham, Senior Neurosurgeon at Sunshine Hospitals Gachibowli. One of the common problems we keep seeing in the outpatient is the backache. It's become a professional hazard. You can ask me how. Long hours of sitting and of course sedentary habits and then increase in the weight, and many a time the whole weight falls on the back. Long hours looking at the system adds to these woes. So we'll talk a bit about the backache. Backache is an area where it's in the lumbar area. In the lumbar area we have 5 vertebrae. Now between 2 vertebrae, each vertebra, there is a structure called disc prolapse. Disc is a very soft structure, which is a very important structure because that avoids the friction between the 2 vertebrae. Imagine a situation where there is no disc. Both the vertebrae will be friction, lot of noise, lot of problems and inconvenience, and sometimes very problems to the patient. At the same time, for some reason if the disc has come out of its place, imagine, that is called disc prolapse or disc protrusion or prolapse disc. All 3 are synonymous. If there is a disc prolapse, the symptoms are backache or pain in one side of the leg, right leg or the left leg. That is known as sciatica. And this pain increases when the patient walks, the patient moves. Any of the movements can increase the pain. And there the problem of diagnosis. And the best investigation today is the MRI. Once the MRI is done, we know where the disc is. The 4th or the 5th are the commonest in our country. And next in place is the L5 and this one. Once the disc is done, then the scare comes into the minds. Now what is to be done? Now many people are going around taking so many consultations because of the worry whether he requires surgery or not. We are very clear that surgery is mandatory only in a very clear situations. But definitely surgery is an option only when there is a weakness of the leg, the difficulty in walking, urinary control, lack of control, or leg becoming thin. These are the situations where the individual likes it or not, that the surgery is mandatory. Then the other situation is, once surgery is done, people are so scared what's out of surgery, whether you are opening the spine, whether you are outside, and various things. Now there are various options. The golden conventional system is called laminectomy and discectomy. That's a very gold standard. Even today it holds good. There are certain refinements today, that is endoscopic discectomy, which is least traumatic. But in Indian situations, let me make it very clear that there is not only a disc, there is what is called a stenosis, that is narrowing of the space from which the nerve root comes out. In such a situation, a simple procedure like endoscopic discectomy sometimes may not deliver the requisite results. Choose a good doctor, good team like the Sunshine Hospitals Gachibowli, where the best will be delivered and whatever the surgical decision will be discussed with you, and only with your consent the surgery is executed. All the best.
Sunshine, it's our sunshine.